Welcome to this short guide all about mastitis and breastfeeding. This guide will help you recognize the signs of mastitis, understand what can help, and know when to seek further support. Mastitis is inflammation in the breast. Sometimes it can develop into an infection. It often happens when milk is not draining effectively from the breast, leading to swelling and discomfort. Symptoms can appear quickly, so recognizing the signs early is important. Common signs of mastitis include breast pain, tenderness, swelling, or a hot area on the breast. Some mothers may also feel flu-like symptoms such as shivering, aches, exhaustion, or a temperature. Redness may appear differently on darker skin tones, so it's important to pay attention to pain, swelling, or feeling unwell. Mastitis can occur when milk is not drained properly from the breast. Factors that can contribute include difficulties with latching, pressure from tight clothing, engorgement, blocked milk ducts, changes in feeding patterns, and injury to the breast. These can lead to inflammation and, in some cases, infection. If you have mastitis symptoms, continue breastfeeding or expressing as normal, as keeping milk flowing can help with recovery. Feed responsively, following your baby's cues, but try to avoid overfeeding or attempting to completely empty the breast. Make sure you rest as much as possible and stay hydrated. Pain relief such as paracetamol or ibuprofen may help, as long as you're able to take them safely. It's also important to check your baby's latch and positioning, as small adjustments can make feeding more comfortable and improve milk drainage. Trying different feeding positions may also help. If your breast feels very full or firm, hand expressing a small amount of milk before feeding can help soften the breast and make it easier for your baby to latch. Cool compresses after feeds can provide comfort and help reduce inflammation. Avoid firm massage or pressing on the breast, as this can make symptoms worse. Wearing loose, comfortable clothing and avoiding tight bras can also help prevent pressure on the breast tissue. It's important to seek support if symptoms are worsening after 24 hours, if you develop a persistent fever, or if you feel very unwell. You should also ask for help if feeding becomes difficult or you are worried about your symptoms. Early support can prevent complications and help you feel better sooner. There are many sources of support available for mothers and families experiencing mastitis or feeding difficulties. Midwives, health visitors, GPs, infant feeding teams, helplines, and local breastfeeding groups can all provide advice, reassurance, and practical support. Reaching out early can help prevent symptoms from worsening and can make breastfeeding feel more manageable and supported. Remember, asking for help is a strength, not a failure, and support is available every step of the way. Please contact your GP if the breast becomes increasingly swollen, develops a lump, or if redness or skin color changes begin spreading or worsening. Redness may look different on darker skin tones, so it's important to also pay attention to pain, swelling, heat, or feeling unwell. In some cases, mastitis can develop into a breast abscess, which may require further treatment. You should seek urgent medical attention if you feel very unwell or develop symptoms such as dizziness, confusion, sickness, diarrhea, or difficulty speaking. These can sometimes be signs of sepsis, which requires urgent medical care. If you are worried about your symptoms, trust your instincts and seek support promptly. This slide shares some simple ways to help reduce the risk of mastitis developing. Try to avoid long gaps between feeds, and if you plan to reduce breastfeeding, do this gradually where possible. It's also important not to let your breasts become overly full. Feeding responsively or expressing a small amount for comfort may help relieve pressure. Pay attention to how your breasts feel and begin self-care measures early if you notice discomfort, swelling, or tenderness. Avoid tight bras or pressure on the breasts, as this can affect milk flow. Remember, early support and responsive feeding can help protect breastfeeding and reduce the risk of mastitis. As we come to the end of this guide, remember that mastitis can be treated, and early support can make a real difference. Listening to your body, responding to symptoms early, and seeking support when needed can help prevent symptoms from worsening. Most importantly, you are not alone. Support is available from your midwife, health visitor, GP, infant feeding team, and local breastfeeding services. If you are worried, reach out early. You deserve support too. Thank you for taking the time to watch this guide on mastitis and breastfeeding. We hope this information has helped you feel more confident recognizing symptoms, knowing what can help, and understanding when to seek support. Remember, mastitis is common, treatable, and support is always available. If you have any concerns about your feeding journey, please reach out to your midwife, health visitor, GP, or local infant feeding team.